Martina Mendoza. I am a West Texas A&M Family Nurse Practitioner student. Today I'm performing a head-to-toe assessment on a 50-year-old female. I have first done her general survey, which included her vital signs, her blood pressure, respirations, pulse, temperature, oxygen saturation, which was 100%, her height, weight, and we've discussed her BMI. I have also done her present medical history, her past medical history, her family history, her surgical history, her social history, her allergies. She has no drug allergies. Her medications. She has no medications. Her immunizations. I have also gone over the review of systems with her. I'm going to start I have also washed my hands for the assessment. I have performed the Snellen chart with her eye exam, testing the optic nerve number 2. And she has 20/20 vision with no corrective lenses. I'm going to start with the head, skin, and nails, assessing for the hair distribution and her skin to make sure it's nice and moist and it's not dry and it's not tinting. Also her nail beds, making sure she's got good refill, making sure it's nice and smooth, that there's no pitting or clubbing, suggesting any cardiac with the clubbing, problems with the clubbing, and any kind of pitting that was assessed for any kind of rheumatoid arthritis. So we're going to go ahead and start with the hair, making sure she's got good hair distribution. Her face is nice and symmetrical. Her skin is nice and warm. We want to go ahead and palpate the head to make sure that there's no lumps, lesions, or soreness or tenderness. I'm going to use a Q-tip to part her hair to make sure she has no eczema or psoriasis or nevi that we're missing or any kind of lesions, which is nice and normal. I'm going to go ahead and palpate her frontal sinuses, her maxillary sinuses. I'm going to palpate her temporal arteries. I'm going to check her temporal mandibular joint. Can you please open and close your mouth? Moving side to side. I am able to put 2 fingers in there and there's no clicking or anything. I'm going to go ahead and assess her trigeminal nerve number 5. Can you please close your eyes and tell me if you feel dull or sharp? Dull, sharp. Okay. I'm also going to go ahead and assess cranial nerve number 7, the facial. Can you give me a smile and make a funny face? Good. From there, I am going to go ahead and move with the eyes, making sure, checking for direct and consensual pupillary response. It would be nice to have it dark in here, but for the video, I'm going to go ahead and keep it light. Direct, consensual, direct, consensual. I'm also going to check for accommodation. Look at my pen light and back to the clock, to the pen light, to the clock, to the pen light, to the clock. I'm also going to go ahead at this point, check for cranial nerve number 3, ocular motor, number 4, trochlear, number 6, abducens with the 6 eye field assessment. Follow my pen light. Checking for any nystagmus or any twitching or moving of the eye. From there, I am going to go ahead and assess the optic disc and the retina. I'm going to brace my hand to stabilize the eye, checking for that red reflex. The retina. Doing the same on the other side. Okay. From there, we're going to go ahead and move on to her nose, making sure that the bridge is nice and smooth. I'm going to check for patency. Breathe in. Breathe in. I'm going to test the cranial nerve number 1, the olfactory. Close your eyes, please. What do you smell? Okay. I'm going to assess her nasal sinus, her nasal septum, and her nasal turbinates to make sure that there's no polyps or lesions or dryness. I see no drainage, redness, or polyps or septal deviation. From there, I'm going to go ahead and move on to her mouth. and make sure that it's nice and pink. It is symmetric. I'm going to go ahead and have her stick out her tongue. And we're checking for cranial nerve number 12, the hypoglossal. Can you please stick out your tongue and move it side to side? Okay. At this point, I'm going to go ahead and check cranial nerve number 9, the glossopharyngeal, and with the gag reflex, and cranial nerve number 10, the vagus nerve, with the ah sound, seeing the uvula rise up and down when she says ah. Takes the glossopharyngeal, open it wide. We're going to check the gag. And she's got a good gag. Now please say ah. Checking the uvula, making sure it rises and sets immediately. Her tonsils are visible, but there's no redness or swelling. I also assess the palate of her mouth, her soft palate and her hard palate. Her teeth, make sure she doesn't have dental caries. Her tongue, making sure she has no skin cancer or candidiasis, making sure to assess the vascularity of her bottom of her tongue. Her gum line to check for gingivitis. And all that is nice and normal. From there, we will go ahead and assess the neck, making sure that her thyroid is nice and smooth. Can you please swallow? Which is nice and smooth, making sure that there's no masses or bulging in that area. From there, we're going to go in ahead and assess the lymph nodes. We're going to start with the preauricle, postauricle, occipital, tonsillar, submandibular, submantle, supraclavicular, superior clavicular, posterior clavicular, supraclavicular. Also, I'm going to go ahead and move to the axillary from right here, and there's nothing there. From there, we're going to move on to the ears and check her hearing. And first, we're going to check to see that she has no lesions, lumps, and make sure that she has a smooth auricles, and which they are. I'm going to go ahead and assess her tympanic membrane and her eardrum and her ear canal, making sure that there's no redness, bulging, drainage, or lesions, or anything obscuring. I'm going to pull up and back, and I see nothing. Everything is nice and normal. Do the same thing to the other side, switching my hands, pulling up and back. There's nothing obscuring the ear canal. The eardrum is nice and normal. I'm also going to go ahead and do the check the vestibulocochlear cranial nerve number 8 with the whisper test. From there, I am going to go ahead and check the Weber and Rhine, checking for the lateralization with the Weber and the Rhine with the air to bone conduction. There we go. Can you hear it on both ears? Yes. Okay. And now I'm going to do the Rhine test. You have a mastoid? You hear it? Yes. Okay. The air to bone conduction should be 2 to 1. From there, I'm going to go ahead and move to the back and check the posterior aspect of the back. First, I'm going to go ahead and assess the skin, making sure it's nice and smooth. She has some nevi, but with the ABC, the asymmetry and the border, irregular borders, contour and diameter, hers are nice and smooth, each one of them. The spine, making sure it's nice and in line, that there's no deviation, seeing some spinal scoliosis. I'm going to check for tactile firmness. Say 99.
99, 99, 99, 99.
I'm going to go ahead and percuss and check for, make sure that we hear resonant and not dullness or any hyperresonance. Resonance is normal. Dullness would mean that the lungs are full, pneumonia, or maybe a mass. Hyperresonance would mean that maybe COPD exacerbation, and we don't want to have any of that. I'm going to go ahead and percuss for the diaphragmatic excursion. Start up here, take a deep breath and hold. Now let it go. Now again, take a deep breath and let it go. And I would measure between the two, which would be her diaphragmatic excursion. At this time, I'm going to go ahead and check for the costal vertebral angle, making sure she has no pain with that. Any pain?
No.
I'm going to go ahead and move to auscultation. Take a deep breath in. Again. 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 Now I'm going to go ahead and check for echophony, bronchophony, and whisper ventriloquy. 99.
99. 99.
And that should be muffled.
99. 99. 99. 99.
We should never listen.
99.
Now I want you to say E.
E. E. E. E.
Over her clothes, but due to her privacy, I'm not going to expose that area. And I want you to go ahead and turn to the front. Exposing her chest, I'm going to check her AP diameter of her chest, making sure that it's not barreled or concave. I am going to make sure that her skin is nice and symmetric, and making sure that all of it is normal, her skin and her, and there's no nevi or lesions or anything like that. First, I'm going to check for tactile firmness.
99. 99. 99.
Okay, I'm going to check for chest excursion. Breathe in and out. In and out. Go ahead and turn around for me because I forgot to check for chest excursion in the back. Checking for symmetry. Go ahead. Again, nice and symmetric. Go ahead and turn around. Keep your gown off. It's okay. From here, I would percuss to check again for resonance and hyperresonance and dullness. Okay, and all that is normal. I'm going to go ahead and assess her lung sounds, making sure that we don't have any adventitious crackles, wheezes, or stridor. Go ahead and take a deep breath in. Checking her lateral aspect of her lungs. Same thing. Okay. At this point, I'm going to check for cranial nerve number 11, her accessory muscles, which will be her last one. Please move your head side to side, up, flex, and extend. Okay. That concludes our cranial nerves. I am also going to go ahead and check her breast with her hands to her sides, making sure that it's nice and symmetric, that her nipples are nice and symmetric. Due to her privacy, I will not expose her breast. Please put your hands above your head and also checking for dimpling or any nipple retraction on your waistline. The same thing, checking for nipple or nipple retraction. Please lean forward. Same thing, looking for dimpling or retraction. Go ahead and move back. We also will check the areola to make sure she has no discharge or any kind of nodules in that area. Right now, I'm going to go ahead and listen to her her heart sounds, checking for S1 and S2, checking the aortic valve in the right intercostal space, second intercostal space, the pulmonic and the left second intercostal space, the upper sternal border of the tricuspid, the lower sternal border, the tricuspid valve, the mitral valve on the fourth and fifth at the apex, the apical. I'm going to have her lean forward and use the bell of my stethoscope to check for aortic murmur, the pulmonic, at the upper sternal border, at the third intercostal space, the fourth, the tricuspid, also the aortic. At this time, I would also listen to her carotid. Take a deep breath and hold it. For swishing or brewing, nothing noted. Same thing, take a deep breath and hold it. No whooshing or brewing at that time. At this time, I will check the point of maximal impulse, which at the fourth, fifth intercostal space. When we're done with that, I'm going to go ahead and lay her back. I'm going to lay back. I would raise the head of the bed 30 degrees to check her jugular venous pressure. I would have move her head to the side a little bit and look at that jugular venous pulsation. Put my card right there at the level of the jugular and set my ruler at the 0 diameter, at the 0 centimeter line, and check the level of her jugular venous pressure, which is at about a 2. Okay. At this time, since she is laying flat, I'm going to go ahead and look at the abdomen, assess the abdomen. She has white striae from when she was previously pregnant, and she has a scar from her C-sections. I'm going to go ahead and auscultate the bowel sounds. At this time, I'm going to listen to the liver for any kind of friction rub. The spleen, and no friction rub. I'm also going to go ahead and listen to the aorta for pushing or brewing, nothing like that. Her renal arteries, her iliac arteries, her femoral arteries. I'm going to percuss her right lower quadrant, checking for any kind of dullness. It should all be tympany. Dullness could mean masses or maybe constipation. If you feel dullness in the middle aspect, it's probably her bladder that is full. Now, I'm going to go ahead and look for the liver span, starting from the nipple line going down at the mid-clavicular line. Until I hear dullness right there. And starting at the umbilicus up to here dullness. And here we go. It's right there. From here, I'm going to go ahead and do palpation of the abdomen. We're going to start with soft, making sure that she has no grimacing or tenderness or guarding. And then we're going to go deep palpation, checking for grimacing, guarding, or pain. We're going to palpate the aorta, and it should be less than 3 centimeters, and hers is less than 3 centimeters. I'm going to go ahead and palpate the liver. Can you please take a deep breath in? It should be nice and smooth. Breathe out. Do the same thing and looking for her spleen. Cannot feel. At this time, I'm going to go ahead, since I'm over here, I'm going to palpate her left kidney. Not palpable. Her right kidney. Non-palpable. From here, I'm going to go ahead and check the sciatic nerve, making sure that she has no pain and has any kind of bulging discs from L5 to S1. I'm going to have her raise her leg straight and dorsiflex the foot. You have any pain? Same thing on the other side. I'm also going to check the range of motion of the hip. I'm going to flex, extend, internal rotate, external rotate, abduct, adduct. Same thing here. Flex, extend, internal rotate, external rotate, abduct, adduct. From here, I'm going to do the same thing but doing her knee. Flex, extend, internal rotate, external rotate, flex, extend, internal rotate, external rotate. Doing the same with the feet. We're going to dorsiflex the foot, plantar flex the foot, dorsiflex the foot, plantar flex the foot. Push against my hand, making sure, checking strength, checking the nail beds, making sure that they have good capillary refill. Also, making sure they're good hair distribution. I'm going to go ahead and have you sit up. Earlier, I did not listen to your breath sounds, and I know it's out of sequence, but I want to go ahead and listen to your breath sounds right now and the interior aspect of the lungs. Looking for bronchi, wheezes, or go ahead. At this point, I'm going to do cerebellar function, and I'm going to check, do point to point, finger to nose. Close your eyes, and I'm going to point to a finger, and then you're going to touch your nose. Now I'm going to have you rub your right heel over your left shin of your leg, up and down. Do the same with the other one. Okay. Now what I'm going to do is, again, checking the cerebellar function. Close your eyes, and I'm going to do what's called stereogenesis, which is describing what I am printing on her hand. And then graphasia. I'm going to place an object in her hand, and she's going to describe what's there. Okay. Okay. At this time, I'm going to go ahead and assess reflexes, her tricep, her tricep, her brachioradialis, her patellar, her Achilles. I'm going to go ahead and check again her carotids. Another time. Her brachial, her radial, her popliteal, both hands, popliteal, posterior tibialis, and dorsalis pedis, making sure that it's a 2+. From here, I'm going to go ahead and have her perform her gait. We're going to do first the Romberg's test, and I want you to go ahead and close your eyes with your hands to the side, checking for ataxia, making sure that she doesn't fall, and that's negative. From there, we're going to go ahead and have her assess her gait. You're going to walk heel to toe and come back. Now walk on your toes. Toes to heel. There you go. There you go. Now, can you go ahead and bend forward and touch your toes? Again, checking her spine, making sure that it's nice and smooth, that there's no deviation showing scoliosis or anything like that. Now go ahead and sit up. From here, I would have her lay down in supine position and lithotomy position to check her perineum, her manus pubis, her labia minora, her labia majora, her clitoris, her cervix, and her vaginal area using a speculum. I would also check for any kind of STDs, any kind of herpes, or any kind of syphilis, or any kind of candidiasis. I would then, if needed, I would assess the rectum for any bleeding, bulging, or hemorrhoids. From here, I would discuss with her the all my findings and making sure that she that we discuss all her negative findings and her plan of care, and making sure that she is consensual with her plan of care. This concludes our head-to-toe physical assessment. Thank you.